Today we're going to be talking about the Level 2 Adult Care Diploma. We're talking about the communication and care settings topic, and we're going to be talking about what is usually learning outcome 4 of that topic, which is being able to apply principles and practices relating to confidentiality at work. So, first task in this is, what is confidentiality? Confidentiality means keeping information private. It is not sharing information with anyone who is not entitled to know it. And it is very important, especially in care work. In care work, you have access to all sorts of private information, or personal information is another way it's phrased, which would include people's names, addresses, dates of birth, could be banking details. If you're visiting somebody's home and they have a bank statement on the table, you would technically have access to their banking details. That has to be kept private. You would definitely have information about their medical history and care needs. This is definitely personal to that individual, and people could be very embarrassed if they thought that their personal information was going to be discussed widely with anyone who didn't absolutely need to know it for their own care. It could also put the individuals at risk, because let's say you're doing home care support, you're visiting someone, they have a key safe by the door, you have the very private and personal information that is the code to the key safe. That has to be kept safe. Back to medical information, if aside from embarrassment, if some medical information became publicly known, that individual could face discrimination in their community. There are a lot of misconceptions about some conditions still, and individuals can be treated like they shouldn't, but they could be treated differently if it became known that they have such and such a condition. So it's important to help them avoid discrimination as well, that if they don't want information known publicly, you're not sharing it, and assume people don't want their information to be public. Okay. Your next question is an observation criteria. It's how could the criteria is to demonstrate that you are keeping information confidential in your day-to-day communications. So how can you do this? You could show it by, if you are entering daily living logs on a laptop or a tablet or a computer, you could make sure that the computer is locked if you have to get up from it. If somebody came in that wasn't working with that service user, you might turn the computer away so they don't see it. It's even if they're within the company, if they don't work with that service user, they don't need to know. And they might not need to know everything as well. Never sharing your password is one. Making sure records are stored securely. So if you are using paper records, make sure they are going into a locked office, preferably in a lockable cabinet, that they wouldn't ever just be left out. Now, in people's care home, or if they're in, not care homes, but if they're in their own home, the care plan is personal. It's full of personal information. Some people like it left on the table, but make sure it's closed. Unless that individual asks you to leave it open for some reason, the default is to close it. So nobody goes looking at it without meaning to and accidentally sees something they shouldn't see. Okay. Other issues that could come up are discussing sensitive or private information in public areas. This could be in a care home. You wouldn't discuss somebody's care in the corridor or in the lounge where anyone could hear it. You wouldn't discuss somebody's care in a cafe. And you would, if there is sensitive or personal information to be discussed with the individual, try and get them in or try and have that discussion in an office or somewhere relatively private. Okay. A written question again is describe situations where information normally considered to be confidential might need to be passed on. Now, with this, an important word is describe. In that, you have to make sure you are giving a description, some more information, an example. So it wouldn't be suitable to just say when you have safeguarding concerns. You would want to talk about safeguarding concerns such as self-harm. In a situation where someone indicates that they are going to self-harm, or that or that you've seen signs that they might be, in those situations you would have to pass it on through your safeguarding channels, to the safeguarding officer, to the line manager, so that this can be investigated and taken place. Same with if you suspect abuse, or if somebody alleges abuse and maybe they ask you, don't tell anyone. You can't ever agree to that. You have to pass it on. You have to act in their best interest, especially in those cases. Well, not even especially in those cases. In all cases, you have to act in the individual's best interest. But in those cases, the safeguarding concern overrides the request not to share this information, because action has to be taken. If you noticed changes in somebody's health and you thought they were declining, in these cases, again, you would have to pass that on to your line manager and have that followed up. If you had a concern about somebody committing a crime, harming others, and concerns about possible extremism, like normally, let's say you saw somebody watching a video and it looked like it might be about bomb making or something. Normally, you're not going to talk about anyone's viewing habits to anyone else, but in this case, you have a concern and you have a duty to pass it on. Your next question as well would be explain how and when to seek advice about confidentiality. So, as to when, as soon as you have a concern, you will go and get advice. Now, this might be a concern about whether you can share information, and you might ask as a hypothetical if you can share this kind of information. You might have a concern that somebody else might be sharing information, or you heard somebody discussing someone's personal information, which you shouldn't have been able to hear. This would be a concern. You might have a concern that the storage is not secure, or that you're collecting too much information. Usually we don't collect any personal information that we don't need to. Just because if we don't have this information, it can't accidentally be leaked. You can't breach confidentiality on it, so it's safest not to keep it. So, any of those situations, that is your when, as soon as possible. How would you seek advice? You can ask your line manager, you can ask them verbally, you can ask them in an email, whatever your normal reporting situations are. Maybe you have a specific reporting form for this kind of concern, and you could put it in that way. You can get some advice from reading the policies and procedures that might be able to answer your question for you if you read them and understand them. If you don't understand them, ask your line manager or a senior colleague. Another way might be to read the relevant legislation. If you need some clarity, maybe you're not sure the policies and procedures match up to the legislation, read the legislation, or at least a summary of the legislation. Some laws that relate to this are the Data Protection Act 2018, Mental Capacity Act 2005, and Equality Act 2010. Now, with regard to confidentiality, the Data Protection Act would be your main piece of legislation. I've included the Equality Act and the Mental Capacity Act because those two could be said to be, well, the Mental Capacity Act definitely is to do with people making choices. That under the Mental Capacity Act, we assume everybody has capacity to make their own choices, and if they are making a choice about confidentiality and the data they're sharing, we should respect that. Unless there is a capacity assessment in place that says that they don't have capacity to make that kind of decision. But for most people, that won't be in place. I've included the Equality Act there as well because disabilities might be, you might think, because it relates to the Mental Capacity Act, you might think that because somebody has a disability they don't have the capacity to make a decision. We assume they do. We have to treat everybody equally and treat everybody equally with regard to data protection. So that's why I would include that one there. All right, so that is everything about, well, far from everything, but it is an introduction to being able to apply principles and practices relating to confidentiality at work. I hope it's been helpful to you, and thank you for watching.